Hello everyone, I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. Today I'm very excited to announce the addition of cryosurgery for outpatient procedures. And the use of cryosurgery is the application of aerosolized nitrogen to freeze off small skin tumors and skin tags. It's a non-painful, self-anesthetizing procedure that does not require general anesthesia. For the purposes of this video, we have Bombay here, and Bombay has a small skin tag that we're gonna remove today. But the great thing about this procedure is that, again, it does not require general anesthesia. We're doing this in one of the surgery suite areas in the hospital, mainly because we have good lighting, but I want to make and emphasize the point that we don't need general anesthesia for this procedure, which is fantastic. So this can be done in the exam room when we're on our way or checking out, and it only takes about 20 seconds, and we can freeze these skin tags off that are potentially growing and could become a problem later. The one major disadvantage of cryosurgery, and I like to talk about it now, is the fact that because we're freezing and we're killing that tissue off, we don't have an ability to send in a histopathological sample to grade whether or not it's malignant or non-malignant. So typically a clinician will need to make the call whether or not a tumor is a good candidate to be cryosurgically removed, because if we destroy the tissue and it's potentially a malignant tissue, we need to know that we got all of it. So sometimes a clinician will make a judgment call based on what the tumor looks like, based on whether or not it's a good candidate for cryosurgery or for actual scalpel traditional removal. So this skin tag that Bombay has is right here on the inside of her thigh. It's probably the size of about an eraser head, and we're going to remove it right now. It only takes a few seconds. So what we're going to do is I'm going to spray liquid nitrogen onto the end of my tip here, and it will freeze and saturate the tip. And once that is frozen, you'll see that there, and I'm going to apply it for about 15 to 20 seconds on the tumor. And Bombay is not feeling any of this at all because it freezes. When it freezes itself, it actually kills the tissue off and numbs the tissue, and that's it. And we're done. And this will take maybe a week to 10 days, and there'll be a little black spot that will develop, and eventually that little tumor will just fall off. Again, I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. That's a new addition of our cryosurgery unit that we have at the hospital, and I hope to see you in the clinic or around the great city of St. Paul soon. Thank you.